Good evening, everyone, and good afternoon if we're in a different time zone. My name is Dr. Kemi De Silva Ibru. I'm a practicing consultant obstetrician and gynecologist. I'm also the founder of a nonprofit, the Women at Risk International Foundation, WARIF. This is an organization that we established in Nigeria in response to the prevalence of rape, sexual violence, and trafficking of young girls and women in communities across the country. I'm here today to discuss a very sobering topic, a topic that affects each and every one of us across different countries, across the world. We all know about the pandemic that has come to define 2020. And understandably, COVID-19 has dominated the agenda worldwide, and mandatory lockdowns have been introduced in many countries to help control the spread of the virus. Now, for many of us, the lockdown was inconvenient. It meant we couldn't go to our normal places of business, and we certainly couldn't visit family or friends, or even socialize in public places. And then the economic effects of the lockdown has also been very devastating in many cases. We've had businesses unable to operate as normal. It has presented huge challenges for education with online schooling, and children sometimes have been taken out of school for weeks and months on end. For some people, though, the freedom to get out of the house is not just a matter of convenience, but of physical safety, or even life and death. Based on my work, I see the great majority of these vulnerable women are female, and this resonates with me today as I give my talk from the safety of my home. As mentioned earlier, I'm a practicing obstetrician and gynecologist, and so I'm all too aware of the prevalence of gender-based violence that occurs in communities across the country I live in, Nigeria. And this is why I founded the nonprofit, the Women at Risk International Foundation, in 2016 in response to this. When we look at the statistics of gender-based violence, and we start with global estimates published by WHO, we're aware that 1 in 3 women worldwide would have experienced an act of violence. This would mean approximately 243 million women and girls have been subjected to sexual or physical violence by an intimate partner. We look at different organizations and agencies. The United Nations Office on Drugs and Crime noted in 2017 that 87,000 women were intentionally killed globally, and more than half of them by intimate partners or family members. Now, this would mean that 137 women across the world has been killed by a member of their own family every day. And this was before the pandemic. With more and more women and girls trapped at home, isolated with their abusers as a result of the COVID pandemic, it has resulted in an increase in the number of cases of violence against women and girls, amounting to what we refer to as a shadow pandemic that we are now faced with globally. I know this is certainly true in my country, Nigeria, which is the largest country on the African continent, with a population of over 200 million people. It's a country that's full of color, heritage, and very rich in pride. But only one marring concern, the patriarchy and the male dominance that many women and girls are subjected to across many communities. The certain cultural practices and norms that unfortunately are harmful and against women have been normalized in many of these communities. And women are not encouraged to speak out, but instead are meant to carry the guilt and the shame of the act perpetrated upon them. Because as we know, in a patriarchy, it is the woman who bears the stigma of gender-based violence. So in my country of 200 million people, where over 100 million of us are women, and at least 60% of us are under the age of 24, our recent demographic and health survey reports that 1 in 4 girls experienced their first violent sexual encounter before the age of 18. as 25% of the female population. And these alarming statistics are replicated in many countries across the African continent and probably the world. And again, this was all before our new normal and before the shadow pandemic. And then we know businesses and schools started to close. Many of us started losing our jobs and our income was in jeopardy. And there was a heightened sense of insecurity with our health and with our finances. And families were forced to spend more time at home. And therefore, this shadow pandemic became apparent in more and more homes across the country and across the world. France, for example, reported a 30% increase in domestic violence cases at the beginning of the lockdown in 2020. And in Argentina, emergency calls from domestic violence cases increased by 25%. In China, domestic violence reports nearly doubled after cities were put under lockdown, with 90% related to the epidemic. The lockdown has also compromised the access of life-saving services and justice at a time when it's most needed. Many one-stop centers, sexual assault referral centers, domestic abuse centers, similar to ours that we run in Nigeria, were forced to close or provide limited services. Strict movement restrictions also meant that survivors were unable to access these sexual assault referral centers and had to rely on helplines to receive any kind of support. Back in Nigeria, in the first 2 weeks of the lockdown, in Lagos State, where I reside, the phones were ringing non-stop at the Warif Rape Crisis Center. This is a sexual assault referral center that was established by the organization in response to medical intervention and forensic medical examination and counseling for survivors of rape and sexual violence. We recorded a 64% increase in calls from women trapped with their abusers and in fear for their lives. The distressing calls from women, young and old, and in many cases, fortunately, we could help. And thankfully, we were able to keep the Warif Center open as a place of last resort. But by June, the authorities in Nigeria became aware of the shadow pandemic, and a state of emergency was declared by the federal government of Nigeria. Now, many women had no recourse during the pandemic, and especially over the lockdown, but to leave their homes to seek out help and services. And so therefore, they would seek refuge with family members. They would seek refuge with friends and with neighbors. And most of them had to rely on services, essential services, that had been scaled back, such as women's shelters, for instance, that unfortunately had to close down. During the COVID pandemic, for any woman seeking refuge in a domestic shelter would need to come with her a negative COVID test. And this was understandable to stem the spread of the virus, and more importantly, to stem the spread of the infection from the community into these shelters. However, public COVID-19 testing had strict criteria to qualify for a free test, because many of these women were disenfranchised and could not afford to pay for the test. And sadly, being abused at home was not one of these criteria. In the more rural and remote areas, the situation was even worse. Many women had to walk miles to receive any form of medical care or attention, as there was no transportation during the lockdown period. The living conditions of many of these women was oftentimes cramped and small. Basic infrastructure was often unavailable, such as electrical power sources, running water, sanitation, and they had no Wi-Fi or internet access to reach out to social media platforms and limited phone services to call 24-hour confidential helplines. So the situation for these women was much, much worse. So at the organization, our solution was this. There are over 3,000 traditional birth attendants working in rural areas across Lagos State today. These are community-based men and women who provide basic healthcare service to women and expectant mothers, but none of them had received any training on how to help women suffering from domestic violence. We successfully trained 1,500 of these men and women as first responders in addressing cases of violence against women in their communities. What this meant was that during the period of the lockdown, these community gatekeepers were galvanized to go house to house in their communities, to use their training that they had received by the Warwick Organization to check on women and girls trapped at home who might be in need of care but could not leave their homes. The reports we had varied. We had verbal abuse, we had emotional abuse, we had far worse beatings and sexual violence. We had children as young as 3 years old reported to have been violated by biological parents. We had the elderly, our oldest patients over the age of 70, who sadly fell prey to another act of violence. But those home visits were also an opportunity for them to share their stories, to receive the much needed care and the support that the traditional birth attendants offered. This program has now been rolled out across another 7 local communities across the state and has reached nearly 120,000 people, raising awareness of this shadow pandemic in these communities. In the months to come, it will continue to expand as we scale out into other states and possibly other countries in Africa. And we will include other gatekeepers, such as the law enforcement officials and religious leaders that come with a large sphere of influence. So we're truly impacting on communities and on the safety and the lives of these women. So as the world continues to face the challenges of the COVID-19 pandemic response, and recovery plans are being put in place to ensure that those most impacted by COVID are not forgotten, it is crucial that this issue remains front and center, and that measures need to be put in place to ensure that help by both relevant governmental agencies and civil societies, such as WARF and others across states, across countries, across the world, are available to meet the scale of this challenge. Because remote working conditions and online schooling is likely to continue. And this would mean that more vulnerable women will continue to be trapped at home with their abusers and consequently be at risk of the pandemic. But I also take hope, and I take a lot of inspiration from the courage and the determination of the many women working to protect and support other girls and women, and to challenge that patriarchy, that cultural bias, that social and stigmatization that is seen in many of these communities, and that male dominance that's evident, that allows for girls and women to be brutalized and to be victimized daily, and for perpetrators to carry out these acts with impunity. I have been awed by the unbelievable strength and tenacity women have shown during these precarious times, and their ability to find their power in spite of all of this adversity. So with or without a pandemic, the work to protect girls and women will continue. We have a responsibility to provide platforms such as these and others worldwide for women to speak out, and then we have an obligation to believe them, to provide better services and infrastructure, and to establish better laws and policies and ensure that these are all implemented. Because every girl and woman, regardless of where she lives, whether it's a rural or urban setting, whether it's in Nigeria or any other African country, whether it's in any other country across the world, she deserves the right to live in a society that is free from any form of violence against her. Thank you very much for listening.
Dr. Ebru?
Yes, I can hear you.
Wonderful. So there's some questions from the audience. Dr. Ellen Ferrante would like to know how they can help further. Can you point them? Oh, Warif is listed as one of our partners. It says sponsors in the events section, Dr. Ellen. So their logo is there and it connects directly to their website. But could you tell us a little bit more how they can help Dr. Kemi if they want it?
Well, with regards to the assistance to organizations like mine, the main concern that we always have is making sure that we're able to raise awareness and place a spotlight on the problem. We're dealing with countries and communities that awareness in many parts of the areas that we work in is next to none. It's not even available. For us to be able to push the awareness, and then secondly, for us to offer services and protection to these girls and women, profit, we need to raise the necessary funding to be able to implement these measured and impactful initiatives across these communities. So collaborations and partnerships with organizations, with individuals is always critical. Volunteers are always welcome. And ensuring that we continue the conversation with platforms like this, I always welcome.
Thank you. And as action items, next steps for collaboration, we had talked about a podcast. You had a podcast that was coming up in the near future?
Absolutely. We have a podcast that unfortunately we don't have that on your platform at this point in time, but very soon, as you and I had discussed previously, the intention is to ensure that we're able to send more than one podcast, series of podcasts on the different aspects of the work that we're doing.
Fantastic. So this is, for us, it's not just about the talk, it's about the action, getting the message forward. And
absolutely,
nothing's more powerful than their stories being shared by them at the end of the day. And so we look forward to sharing that with everybody that comes onto our platform as well. And you can check that out at sheconomy.com. Those apps are going to be ready. We're going to do a Mother's Day series for Amplifying Her Voice. So by then, I think your podcast will be ready and our apps will be ready for mass distribution then.
Thank you.
Yes, thank you. So 2 months to go. We'll see you back. Thank you for joining us and thank you for sharing this such an important message. And this session is recorded, so we will share it with you once we get it back from Huffin.
Thank you very much, Anu, for the opportunity and for such a great platform.
Thank you.
Pleasure being here. Have a good evening.
Bye-bye. You too. Bye-bye.